Well, first, let me put it in some context. So I was able to sponsor the lead kind of medical civil rights bill of our time that was established to try to end the separate and unequal treatment for those who receive care for mental health and addiction, where they're literally not treated within the medical system, but rather they're treated kind of as on the periphery or some separate kind of system of care that isn't properly funded, doesn't have the same kind of expectations on it that the rest of medicine would be. So I'm the one who introduced the law and that was the primary sponsor of saying we couldn't allow this to continue. And the best way to prohibit it in the future is to make sure that it is reimbursed in the same way that the rest of medicine would be reimbursed. Because that way you could begin to truly integrate it, since now there wasn't any reason for it to be separate anymore, since it was now considered part of the house of medicine. But to put the context around how difficult things are in terms of the stigma and shame that continues to persist, I was the youngest member of Congress at the time from the smallest state in the country, Rhode Island, and yet I got to put my name first on this bill. So I often tell people, they say that I'm a leader in mental health policy, but frankly, they got me by default because there were very few who wanted to put their name first on a bill that was called the Mental Health Parity and Addiction Equity Act, because God forbid a reporter would ask them, do they have a history of mental illness or addiction? And if they do, then Katie bar the door, there would be 35 more questions about, well, what medications were they on? When were they in treatment? If their family members had an issue, was this purely to get them coverage? In other words, no politician really wanted to wade into those treacherous waters. Fortunately, if you will, for me, I was already out, so to speak, with my acknowledgement that I had been treated for mental illness and addiction. And so it was easier for me to kind of put my name first because those questions had already been asked and those questions had already been answered. So.